Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the MCQs of the gross anatomy of upper and lower limb with their explanation, and remember these MCQs are taken from the internal exams of different medical colleges. So first MCQ for today's class is that a 70-year-old lady slept in the bathroom and fell on the bathroom floor. As a result, she had a posterior dislocation of the hip joint and fracture of the neck of the femur. Rupture to the ligamentum teres may lead to damage to branch of which of the following artery? So options are either medial circumflex femoral artery, the lateral circumflex artery, the obturator artery, superior gluteal and inferior gluteal artery. So look at this diagram. Here you can see this is the area, the ligament of the head of the femur or ligamentum teres is attached over here, and in close relation to the ligamentum teres, the obturator artery is passing. So whenever the ligamentum teres or ligament of head of femur will be injured, there will be damage to the obturator artery. So obturator artery is the correct option. Next MCQ is that the erector spinae muscle is innervated by axillary nerve, the accessory nerve, the branches of the posterior cord of the brachial plexus, the dorsal rami of the spinal cord, and dorsal scapular nerve. So first look at this diagram. These are the different three portions of the erector spinae muscle. This is the spinalis muscle, one is the longissimus, and this is the iliocostalis muscle. So these three parts of the erector spinae muscles which are present on the back. And then look at this cross section. So these are the this is the spinal nerve, its dorsal division and ventral division, and this dorsal division that giving branches to supply the erector spinae muscle. So the correct option for this is the dorsal ramus of the spinal cord. Next MCQ is a lady in the emergency clinic is diagnosed as having a thrombosis of the popliteal vein. So this will cause most likely a reduction in blood flow in which of the following vein? So we all know that the popliteal vein drains into the femoral vein, so the blood flow to the femoral vein will be reduced. Next MCQ is there are many layers of the muscles in the foot. The quadratus plantae muscle is present in one of these layers. Which one of the following correspond to action of the quadratus plantae? That is also called the flexor digitorum accessorius. So either it causes extension of the toes, the adduction of the toes, the abduction of the toes, helps the flexor digitorum longus, inflection of the toes, and straighten the pull of the flexor digitorum longus or extension of the MTP joint. So look at this diagram. This is the quadratus plantae, also called the flexor digitorum accessorius. It inserts into the tendon of the flexor digitorum longus so that it helps the flexor digitorum longus inflection of the toes and straighten the pull of the flexor digitorum longus, and this is the answer to the question. Next question is that the professor of the anatomy was explaining muscles of the foot. He said that in hand and foot a muscle is inserted into another. So which option is correct? Again same diagram. This is quadratus plantae which is inserted into tendon of the flexor digitorum longus. So the option A is correct in this MCQ. Which one of the following is the largest segment of the movable part of the vertebral column? The cervical, coccygeal, lumbar, sacrum and thoracic. So obviously thoracic segment is the largest movable segment of the vertebral column. Option E is correct. Next MCQ is the following structures passes deep to the flexor reticula except which? That is flexor digitorum superficialis tendon, median nerve, flexor pollicis, the ulnar nerve and the flexor digitorum profundus. So look at this diagram. This is the flexor reticulum. Here you can see the flexor digitorum superficialis and the tendons of the flexor digitorum profundus. Then the median nerve and then the flexor pollicis are lying deep to the flexor retinaculum except the ulnar nerve which is superficial. So this ulnar nerve is the answer to this question. Option D is correct. Which of the following muscle has dual nerve supply? Very simple question. Sartorius, gluteus maximus, adductor longus, magnus and brevis. So we all know that the adductor magnus has a dual blood supply, and this is the answer to the question. Next question is, following tendons are inserted into base of the proximal phalanx of the thumb except which? The extensor pollicis brevis, abductor pollicis longus, oblique head of the adductor pollicis, flexor pollicis brevis, first palmar interosseous nerve. So look at this diagram. This is the flexor pollicis brevis and abductor pollicis brevis inserted. And also look at this diagram. This is the abductor pollicis longus which is inserted into first metacarpal bone, not into the proximal phalanx. So option B is the correct option for this question. Next question is, following muscle abduct the hand at the wrist joint except. So very simple question. We are looking at the abductors, the flexor carpi radialis, abductor pollicis longus, extensor carpi radialis longus, extensor digiti minimi and extensor pollicis longus. So we all know extensor digiti minimi helps in adduction and not in the abduction. The following bones form the proximal row of the carpal bones except, that is the lunate, the pisiform, scaphoid, triquetral and trapezium. So just remember this mnemonic, that is some lovers try position that they can't handle. S for the scaphoid, L for the lunate, T for the triquetral and P for the pisiform. So both trapezium and trapezoid are in the second row, and then correct option is E. It is not present in the proximal row. Now, anterior facial compartment of the forearm contains the following arteries except which, that is brachial, anterior interosseous, radial, ulnar and profunda. So these all arteries, the anterior and the posterior interosseous arteries, the ulnar artery, the radial artery are present over here. Brachial artery divide in the cubital fossa, so it is not present in the anterior compartment, and this is the answer. Next MCQ is, the boundaries of the anatomical snuff box include following except which, that is abductor pollicis brevis, extensor pollicis longus, extensor pollicis brevis and abductor pollicis longus. So look at this image. This is the tendon of the extensor pollicis longus, and these two are the tendons of the abductor pollicis longus and extensor pollicis brevis, which are forming the boundaries of the anatomical snuff box. So abductor pollicis brevis is not included, and this is the answer to the question. Following structures are attached to the greater tuberosity of the humerus except which, that is the supraspinatus, the coracohumeral ligament, teres minor, infraspinatus and subscapularis. So look at this diagram. This is supraspinatus, infraspinatus and the teres minor muscle, all forming the rotator cuff, are attached to the greater tubercle, while subscapularis is attached to the lesser tuberosity of the humerus, and this is the answer to the question. Following structures form the boundaries to the cervico-axillary canal of the axilla except which. So look at this diagram. First, this is the clavicle forming anterior boundary, then the upper border of the scapula forming posterior boundary, and the outer border of the first rib forming the medial boundary. So this is the axillary inlet, also called cervico-axillary canal, and coracoid process is not forming the boundary. So this is the answer to the question. Next question is, carpal tunnels contain following important structure except which, that is flexor pollicis longus, flexor digitorum profundus, median nerve, flexor carpi radialis and flexor digitorum superficialis. So look at this diagram. This is the area. You can see the tendons and the sheaths of the flexor digitorum profundus and flexor digitorum superficialis along with the median nerve and the flexor pollicis longus passing over here. In also this section you can see the median nerve, the tendons of the flexor digitorum superficialis and flexor digitorum profundus along with the flexor carpi radialis, which flexor pollicis longus, which are all passing deep to the carpal tunnel, and the flexor carpi radialis passes superficial, so it is the answer. Next question is that the wrist drop can result from damage to the which nerve? Obviously this is the radial nerve which causes the wrist drop. Median, ulnar and anterior interosseous are not included. Next question is, an inability to oppose the thumb to the little finger can result from damage to the which of the nerve? That is anterior interosseous, posterior interosseous, radial, ulnar and median, and answer is median nerve because it supplies the thumb and it is involved in opposition of the thumb to the little finger. Next question is, musculocutaneous nerve originate from dash part of the brachial plexus? That is from the posterior card, from the lateral card, both medial and lateral cards, upper trunk and medial trunk. So first have a look at this diagram of the brachial plexus. This is the lateral card, this one is the posterior card, this one is the median card. First look at the roots from C5, C6, C7, C8, T1, then C5 and C6 join to form upper trunk, C7 form middle trunk, and C8 and 10 T1 form the lower trunk. Then they divide into a ventral and dorsal rami. So ventral or anterior rami of the upper trunk join to form the lateral card. The ventral rami of the lower trunk form the medial card, and dorsal rami of all these form the posterior card. So musculocutaneous nerve is basically a branch of the lateral card, and this is the answer to the question. Lymph from the upper lateral quadrant of the breast drains mainly into lateral axillary, internal thoracic, posterior axillary, anterior axillary and deltopectoral group. So look at these different group of the lymph nodes. This one is the anterior axillary, this is the subscapular axillary, the lateral axillary, the interpectoral lymph nodes. So most of the lymph from the upper outer quadrant basically drains into anterior axillary lymph node, and this is the answer. Next question is that the medial collateral ligament of the elbow joint is closely related to brachial artery, radial nerve, ulnar nerve and basilic vein and the ulnar artery. So this is the ulnar nerve which is closely related to medial collateral ligament, and this is the answer. Regarding the clavicle, all are true except it is an example of short bone. It is first bone to ossify in the fetal life. It ossifies in the membrane. It is a commonly fractured bone and it has no medullary cavity. So answer is it is not a short bone, rather it is a long bone, and this is the correct option. Next question is, the inferior surface of the clavicle gives attachment to all of the following except, that is conoid ligament, trapezoid, sternocleidomastoid, pectoralis major and subclavius muscle. So look at this. This is the conoid ligament, the trapezoid ligament, subclavius muscle and pectoralis major. So sternocleidomastoid is the answer. Next is surgical neck of the humerus is related to radial nerve, the axillary nerve, the ulnar nerve, median nerve and none of the above. So look at this diagram. This is the axillary nerve which is related to the surgical neck of the humerus, and this is the answer. Next is, one of the following is the branch of the second part of the axillary artery: lateral thoracic, anterior circumflex, posterior circumflex, superior thoracic and subcapsular arteries. So look at this diagram. This is the first part, this is the second part, and this one is the third part, and the lateral thoracic artery is basically a branch of the second part. Now the of paralysis, the deformity is called winging of scapula, the claw hand, ape hand, wrist drop, and policeman's tip position. So correct option is the policeman's tip position. In Klumpke's paralysis, deformity is called winging of scapula, claw hand, ape hand, wrist drop, and policeman's tip position. So in Klumpke's paralysis, the claw hand is the answer because of the unopposed action of the long flexors and extensors of the finger, because their nerve supply to the antagonist of these muscles are damaged. In order to check and see if the nerve is traveling in anterior compartment of the leg is damaged, the physician check for the sensory loss in, so the area between first and second tarsal bone. So we all know that the anterior compartment of the leg is supplied by deep peroneal nerve, and this is the area which in the sensory loss where the physician will check the deep peroneal nerve, that is the first and the second toe. Femoral artery travels within the adductor canal, the Hunter's canal, to reach the popliteal fossa. So which of the following muscle form anterolateral boundary of the canal? That is vastus lateralis, the sartorius, vastus medialis, adductor magnus, or adductor longus. So look at this diagram. This is the adductor canal, and this boundary is the anterolateral boundary, and this is the anteromedial boundary, and anterolateral boundary is formed by the vastus medialis. So this is the correct option. Next MCQ is muscle known for the tailor master. Very common question. This is the sartorius. Next is largest muscle of the body is very simple question. This is gluteus maximus. Next is the first gear muscle is very simple question. This is soleus. Next question is that which of the following muscle is partially paralyzed when obturator nerve is damaged? So sartorius, adductor longus, adductor magnus, adductor brevis, and pectineus. We all know that the adductor magnus has a dual blood supply. That's why because of the damage to the obturator nerve, it will be partially paralyzed. Next question is oblique popliteal ligament is formed by the popliteus, the semitendinosus, semimembranosus, biceps femoris, and adductor longus muscle. So look at this diagram. This is the oblique popliteal ligament, and it is formed as a continuation of the semimembranosus. So correct option is C. Saphenous opening is situated 1.5 inch either lateral to pubic tubercle, inferior to pubic tubercle, below and lateral to pubic tubercle, below and medial to pubic tubercle, or none of above. So look at this diagram. This is saphenous opening, and here is the pubic tubercle, and this is located below and lateral to pubic tubercle. So C option is correct. Next is trochanteric anastomosis provides main blood supply to the head of the femur, neck of the femur, greater trochanter, lesser trochanter, or shaft of the femur. So look at this. This is the trochanteric anastomosis, and it is basically supplying the head of the femur. A patient has a torn rotator cuff of shoulder joint as a result of an automobile accident. Which of the following muscle tendon is intact and has a normal activity? The supraspinatus, teres minor, subscapularis, infraspinatus, and teres major. So we all know that the teres major is not included in the rotator cuff, so it will be spared and it will be normal. Next is anastomosis around the body of the scapula is between first part of the subclavian and third part of axillary, second part of subclavian and second part of axillary, third part of subclavian, third part of axillary, first part of subclavian, second part of axillary, and third part of subclavian, first part of axillary. So look at this diagram. This is the thoracoacromial thyrocervical trunk, which is giving a branch, that is the suprascapular artery, and it arises from first part of the subclavian artery. Second is the subcapsular artery, which is giving the circumflex scapular artery, and this is forming the anastomosis around body of the scapula. So it is from first part of subclavian, and it is from the third part of the axillary artery. So correct option is A. The brachial plexus consists of roots, trunks, division and branches, so which is not a branch of the posterior guard. Upper subscapular, lower subscapular, suprascapular, axillary and radial. So first look at the branches of the posterior guard. So these are the axillary nerve, the radial nerve, the median nerve, sorry, not the median nerve, radial, axillary, and this is the lower subscapular and the upper subscapular, and these are all the branches of the posterior guard. And this the suprascapular is over here and it is coming out of the upper trunk. So this is the answer. Next question is, the clavipectoral fascia is a fibrous sheet situated deep to the clavicle portion of the pectoralis major muscle. Which one of the following does not pierce the clavipectoral fascia? That is cephalic vein, thoracoacromial artery, medial pectoral, lateral pectoral nerve, and none of the above. So medial pectoral nerve basically do not pierces the clavipectoral fascia. 27-year-old patient with a known carpal tunnel syndrome experienced difficulty in finger movement. Which nerve is compromised? So we all know that in carpal tunnel syndrome, this is the median nerve which is compromised, and it is the answer. Next is, 12-year-old boy walks in. He fell out of a tree and fractured the upper portion of his humerus. So fracture of the humerus at mid shaft is likely to cause injury to which of the following nerve? That is either median, ulnar, musculocutaneous, radial or subscapular nerve. So look at this diagram. This is the part where the mid shaft of the humerus is present and it is in close relation to the radial nerve. So radial nerve will be damaged, and this is the answer. 35-year-old man walks in with a stab wound to the most medial side of the proximal portion of the cubital fossa. So which of the following structure most likely would be damaged? That is biceps brachii, radial nerve, radial artery, brachial artery, and median nerve. So this the mnemonic for this, as I have already told you, that is MBBR, that is median nerve, which is most medial, then is the brachial artery, then is the biceps brachii, and then is the radial nerve. So as median nerve is most medial thing in the cubital fossa, this will be damaged, and E is the option. 21-year-old woman walks in with a shoulder and arm injury after falling during horseback riding. Examination indicates that she cannot adduct her arm because of paralysis of the which of the following muscle? The teres minor, supraspinatus, latissimus tarsi, infraspinatus, and teres major. So first remember, teres minor, supraspinatus and infraspinatus are the rotator cuff muscles, and serratus anterior muscle which is present which help during the respiration. So option is the latissimus tarsi. This latissimus tarsi is included in the adductors of the arm in addition to the deltoid and the triceps brachii and the coracobrachialis and teres major muscle. So correct option over here is the latissimus tarsi. Next is a 29-year-old man comes in with a stab wound and cannot raise his arm above horizontal and exhibits a condition known as winged scapula. So which of the following structure of the brachial plexus is most likely to be damaged? So first you should all know that winging of the scapula is because of the damage to the serratus anterior, and serratus anterior is supplied by the long thoracic nerve. So here just look at this long thoracic nerve. This is the branch from the roots. So the correct option to this question is E, that is the root. So in this condition roots will be damaged, which will lead to winging of the scapula. Next question is intertubercular grooves contains which tendon? The short head of the biceps brachii, long head of the biceps brachii, long head of triceps brachii, coracobrachialis and the pectoralis major muscle. So look at this. This is the biceps brachii and it's a long tendon which is present. So correct option is B. Next MCQ is which of the following thigh muscles serve as both hip and knee flexor? A very simple question. Sartorius is the answer. Next is sural nerve is a cutaneous nerve which supplies lower half of the posterior aspect of the leg. So it is the branch of the anterior division of the femoral nerve, posterior division of the femoral nerve, the obturator, tibial, common peroneal. Little bit indirect question because sural nerve is formed by combining the medial sural cutaneous nerve and peroneal communicating nerve. So these two nerves join to form the sural nerve, and medial cutaneous sural cutaneous nerve is a branch of the tibial nerve. So this is the answer to the question, that is D option. Which of the following arteries form chief blood supply of the posterior compartment of the thigh? A very simple question, that is posterior compartment of thigh are supplied by perforating branches of the profunda femoris artery. So C option is correct. All of the following muscles are primary adductors of the hip joint except adductor brevis, adductor longus, adductor part of adductor magnus, and hamstrings part of the adductor magnus and the gracilis. So obviously we know hamstring part is basically extensor and it is not the adductor, and this is the answer. A motorcyclist had road traffic accident in which his head was violently separated from the neck. His C5 to C6 roots of the brachial plexus were seriously injured. Next day, he develops the porter-tipped hand deformity, also called the Orb's paralysis. So, which one of the following nerve is responsible for flexion at the elbow joint? So, we all know in Orb's paralysis, the musculocutaneous nerve is involved. It is damaged, which is supplying the flexors muscles at the elbow joint, and this is the answer. Next is which of the following arteries rises from the first part of the axillary artery? The superior thoracic, lateral thoracic, thoracoacromial, subscapular and anterior. So look at this diagram. This is the superior thoracic which is originating from first part of the axillary artery. So A is the answer. Next is given below are major peripheral branches of the lumbar plexus. Which amongst them is purely sensory? So we all know that the lateral cutaneous, as name indicate, this is purely sensory, and D is the correct option. Popliteal fossa is a shallow depression located at back of the knee joint. Which of the following structure is located most superficial in this fossa? That is popliteal artery, popliteal vein, knee joint capsule, popliteus muscle or tibial nerve. So look at the relation. Tibial nerve is most superficial, then is popliteal vein, and then is the artery. So tibial nerve is the answer. Next is following a subcapital fracture of the neck of the femur. An 80-year-old man sustained avascular necrosis of femoral head. This is most likely to be consequences of interruption to the blood supply to the head from which of the following sources? So we are looking the area where the subcapital fracture is damaged and is supplying to the avascular necrosis of the femoral head. The arteries from trochanteric anastomosis in reticula, the arteries of ligament of head from the obturator, branches from profunda femoris, branches from pudendal, and branches from inferior gluteal artery. So look at this diagram. The branches of the profunda femoris, this is the lateral and the medial circumflex arteries which are supplying the area which is damaged in subcapital fracture. So this is the answer, that is branches from the profunda femoris artery will be damaged, that is medial and lateral circumflex arteries. Foot drop is a clinical condition in which foot appears permanently plantar flex and patient loses ability to dorsiflex the foot at ankle joint. Damage to which nerve causes this condition? A very simple question, because foot drop is obviously because of damage to common peroneal nerve, because this nerve is supplying all the muscles which are involved in dorsiflexion of the foot. Next is a man got a sharp cutting wound on middle of his arm and is rushed to emergency. It was found that the wound was deep, almost up to the bone. So which artery might have been cut? So please remember that this is middle of arm and medial side of middle of the arm. So these are the arteries, and look at the branches. This is the brachial artery which is present on medial side of middle of arm, and this will be damaged. So answer is the brachial artery. Next is regarding the movements that takes place at hip joint. Which of the following muscle is most powerful extensor of the hip joint? So obviously this is gluteus maximus. Next is the strongest fiber of the deltoid ligament of ankle joint extends from medial malleolus to the medial tubercle of talus, neck of talus, sustentaculum talli, navicular bone, and medial cuneiform ligament. So look at this. This is the medial collateral ligament, and it's different from the posterior tibiotalar ligament, the anterior tibiotalar ligament which is present over here, and this is attached to sustentaculum talli, which is the strongest fiber of the deltoid ligament. So this is the answer. So next question is, which of the following nerve innervates the muscle which are directly responsible for dorsiflexion and inversion of the foot? So this is the tibialis anterior, and this is supplied by deep peroneal nerve. So question beta is the answer to this question, and this is your last slide for today's class. Thank you very much, dear students, for your attention for today's class, and Allah Hafiz till the next class, and also best of luck for your professional exam.